Good afternoon and thank you for joining us. My name is Tina Tebow and I will be your moderator for this afternoon's briefing. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Today we're reporting one new case of COVID-19. That case is in the Central Zone and is travel related. As of today, there are 11 active cases of COVID-19 in Nova Scotia. Since Saturday, we've been reporting either one new case a day or even better, zero. And that is great news. Our vaccination program continues to roll out, but we have some serious concerns about supply. We had hoped that we wouldn't be in this situation, but we will not be receiving any new doses this week. Because we've held back our second dose, we still have supply, and it is our hope that everyone will be given their second shot to those who have received their first shot. When the supply ramps up, we will continue to make sure that we have the infrastructure ready to deliver new shots to Nova Scotians. Dr. Strang.
Thank you, Premier. Good afternoon, everybody. And as the Premier mentioned, we have one active case in the Central Zone today for a total of 11 active cases in Northern, Eastern, and Central Zone health zones, with no one in hospital. Since our last news conference, we have seen low or no cases each day. This is great, but we must remain vigilant and comply with all the public health measures if we want this trend to continue. One of our recent cases is a Dalhousie student, and so, continuing to be very cautious, we are encouraging post-secondary students who attend a campus on the Halifax Peninsula to get a COVID test, especially those who recently returned from outside Nova Scotia, PEI, or Newfoundland, even if they tested negative during their quarantine. So please go online to book your asymptomatic test or go to the clinics that are being held on the Dal campus today and tomorrow. The Nova Scotia Health Authority Public Health mobile unit van is outside of the computer science building on University Avenue from 10 to 5:30 today and tomorrow. And while we're encouraging students, especially students who have recently traveled, it's open for anybody. There is substantive COVID activity in most of Canada and in many other countries. We are still in the middle of the second wave. There is the emergence of warring new variant strains, and our vaccine supply remains uncertain. We have to remain cautious, and that is why we cannot travel broadly right now. My office is already getting questions from people looking to make plans to travel down south this winter and how they can get a test before they go. That is wrong. I cannot stress enough that now is not the time to be traveling, even within our country. The Prime Minister is saying this, let alone internationally. Travel greatly increases the risk of bringing COVID-19 and COVID-19 variants back into Nova Scotia. So unless it's essential travel, Canadians and Nova Scotians, please stay close to home. I wanted to give a brief testing update, a brief update in relation to the positive cases from the Marine Atlantic Ferry employees that we reported last week. The two crews that were impacted have been tested and results have come back negative with one exception. There have been no passengers from any of the affected routes that have tested positive. As promised, promised at the briefing last week. Today, I'm going to give an update on how we're doing with our 30-day vaccine rollout plan. And I also want to note that, as we said last week, today we are posting for the first time more detailed vaccination statistics on our coronavirus website. And we are currently we're reporting both the total and number of both first and second doses that are administered. And we'll be doing that on a daily basis, and we'll be updating the more detailed information weekly every Tuesday. And so today we are sharing this first weekly report, and as I said, it's on our coronavirus website. Over the next 3 months, we are focusing on delivering vaccine to healthcare workers who are directly involved in frontline COVID response, as well as staff, residents, and designated caregivers in long-term care and residential care facilities. This week we have healthcare worker clinics in 4 locations, in Halifax at the Dalhousie University, Cape Breton Regional Hospital in Sydney, Valley Regional Hospital in Kentville, and Colchester East Hants Regional Hospital in Truro. These clinics, with the exception of Truro and Dalhousie, will run again next week, and the ones that we don't have vaccine for next week will resume once we get additional vaccine. We continue to make progress in our long-term care facilities. Vaccination of staff, residents, and designated caregivers has been completed at the Northwood, both their Halifax and Bedford campuses, Harbourstone Enhanced Care, Ocean View Continuing Care Centre, and Parkstone Enhanced Care is 98% complete and will finish this week. And by Thursday, an additional 7 long-term care facilities across the province will have vaccine to start their immunization programs. Long-term care staff at these facilities will be invited to the local healthcare worker clinics, and that will ensure that we have enough of the appropriate vaccine for the residents and designated caregivers to be vaccinated on site at these long-term care facilities. So both our healthcare worker and our long-term care clinics are going well. There is good uptake, and we continue to have virtually no wastage. And the vaccine we have, we will use up the vaccine before we get additional vaccine from the federal procurement. We also talked last week about some prototype clinics that we're planning over the next few months. These are community clinics that will help us understand what works and what doesn't work. So when we're ready to administer large quantities of vaccine, we are able to do so immediately. So we're starting with a prototype community clinic at the IWK Health Center. This clinic will be for those in the community who are over 80 years of age. And we're currently working through how those individuals will be invited, and the clinic will likely be starting mid to late February. And so we'll share more information as those plans get finalized. We are also in active discussions to establish prototype community clinics with our First Nation elders, the Pharmacy Association of Nova Scotia, and Doctors Nova Scotia. And we're also connecting with representatives from the African Nova Scotia community next week. So let me end today's vaccine update by talking about how we're going to prioritize once we get substantive amounts of vaccine. The science is very clear. The single biggest risk factor for death or severe illness from COVID-19 is age. The data tells us that 90% of people who have died from COVID-19 are over age 80. So given that, it's logical, and I would say it's critical, that age be the main factor in how we sequence our immunization program. I appreciate and respect that many groups are lobbying on behalf of their employees or members with specific health conditions to be a priority to receive vaccine. But I want to be clear that Nova Scotians' plan will be driven by science and risk, and by far the biggest risk factor is age. So as we roll out our community clinics, the main way we prioritize people will be in age group cohorts by decreasing age, starting with our seniors, and that is why our first prototype clinic will be known for Nova Scotians who are over age 80. You've heard me say many times over the past year that the best thing we can do to protect one another and to keep our community safe is to protect our most vulnerable by following the public health measures. So I'm asking all Nova Scotians to do the same thing when it comes to vaccine. Be patient. You will get an opportunity to get vaccine, but let's vaccinate those who are at most risk and need the vaccine most first. There will be enough for all Nova Scotians. And our plan, we're still on target for all Nova Scotians having an opportunity to be vaccinated by the end of September. So let me finish up by noting that yesterday was the 1-year anniversary of the first COVID-19 case confirmed in Canada. It has been a long haul for every one of us, but I think it's important to take a moment to acknowledge how well Nova Scotia is doing. Just this morning, I was sent an article from a German publication touting Atlantic Canada's response to COVID and what a model it is. What we are doing is working, and it's great to see everyone's commitment and hard work being recognized. Our epidemiology has been and continues to look good, and this is due to a number of factors, including our geography, learning from other provinces, our strong and responsive collaboration with partners and government, and swift action when necessary, and a slow, cautious reopening. Nova Scotians have stepped up and cooperated with public health measures and the slow, cautious approach in all our communities. It's this ongoing community response that ultimately is what has and continues to lead our success. So I believe it is this caring and considerate spirit that will carry us through the vaccine rollout as well. Your cooperation in this past year is why we are seeing the numbers we are seeing right now. And for this, I want to extend my deepest gratitude to all Nova Scotians. You have saved lives by your actions. But I ask that you continue to do what you are doing. Please continue to take the necessary precautions. We are not able to let up yet. Premier.
Thank you, Dr. Strang. Tina.
Just to note, we are having some technical issues. Please watch us on Facebook or on Eastlink. Our YouTube channel is currently down. We will post a copy of today's broadcast on YouTube when it becomes available. Again, a reminder, we'll take one question and one follow-up from reporters on the line in the allotted time that we have for today. We will start with Shayna Luck from CBC. Go ahead, Shayna.
Good afternoon. First question for Dr. Strang. And you mentioned briefly community clinics, prototype clinics. Yesterday, Regional Chief Paul Prosper issued a statement calling for a Mi'kmaq-specific vaccination strategy. And he said he's concerned there are no Mi'kmaq representatives on the expert panel on vaccines. So I'm wondering if you can elaborate on the update on the prototype clinics and speak to Chief Prosper's concerns about how Mi'kmaq communities and specifically elders will be prioritized.
So two things. Our vaccine expert panel are people who are there for their expertise in immunology and vaccinology. That is not the place for community engagement. I've been throughout the pandemic. I've been meeting every 2 weeks with the First Nations chiefs. We have specifically reached out, and the vaccine planning team are having ongoing discussions with our First Nations elders and the health directors of all those communities. They're the ones that are informing exactly where and when we will do the first prototype clinic, and we have committed to them that as a priority, once we get more vaccine, we will make immunization in our vulnerable communities, including our First Nations communities, a priority, and we will work with them so they will have significant input into how the vaccine rolls out in their community, who gets prioritized first. So we have made a substantive investment and will continue to do so in engaging our First Nations communities in the whole COVID response and around vaccination.
Go ahead, Shayna, with your follow-up.
Thank you. My second question is for the Premier. Premier, the province and the federal government did transfer funds to municipalities to make up for a shortfall in this budget year, I know, but it does seem likely the pandemic is going to continue on further. Municipal revenues may be affected into the next budget year. I'm wondering what discussions you're having about offering further municipal support or negotiating further support with the federal government.
That would be a conversation that would be happening with the minister and the UNSM. I have not been directly involved. I would say this is very different, though, than in the spring when we completely shut down almost all aspects of our economy across the province. We have not done that this go-around. I think the business community it will be impacted, certainly. I think here in HRM when it comes to the business tax associated with their properties. But as we said back in the spring, those who could pay their municipal taxes, we would encourage to do them, to pay them on time. And that would be my message again. Good parts of our economy are still functioning. It is incumbent on all those that are still working, receiving an income to make sure that we pay those municipal taxes so that the municipality can continue to provide that services. But I have not had any contact with our local UNSM. That would have been at the minister level.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Hi, Dr. Strang. I'm wondering what this pause that's coming up is, I guess, Pfizer, retools. Do we know how long it's going to be? I guess we're hearing about a week. And once we get more supply, will we continue to distribute it conservatively, or will we be able to get the first shots into more people more quickly once we get that ramped up supply?
So I think we know we're not getting any Pfizer vaccine next week. The week after, we're getting 1,950 doses, a tray of vaccine. Beyond that, there's no certainty of what the amount of vaccine, whether it's Pfizer or Moderna, we're going to get. We're also getting in 2 weeks' time, the week of February 1st, along with the Pfizer, 5,400 doses of the Moderna vaccine, which is all for long-term care facilities, our priority. We still continue to be assured that this is a short-term delay, and that the amounts that are held back now will be made up as we get into deliveries in February and March. But that has not yet been finalized. We are committed to having a strategy that holds back the second dose that for a number of reasons. First, our epidemiology it puts us in a position where we perhaps don't have to feel the pressure that other provinces, but the science is actually solidly behind, and the statement from my colleagues, the Council of Chief Medical Officers of Health. We have been very clear that provinces should stick with the schedule that has the vaccine under which it has been approved, unless there are substantive, compelling circumstances from a logistic or an epidemiologic reason to do otherwise. We are not in that position, and we remain focused on making sure that we get everybody 2 doses within the time frame under which the vaccine is licensed.
Keith, and our biggest concern at the very outset of this was consistency of supply. It wasn't the amount. Obviously, we want as many doses as we can get, but we were concerned about the consistency of supply, knowing that the manufacturers are still, and public health are telling us to stay on the appropriate space between your first and second shot. I think it's around 28 days, 21 to 28 days. We want to reassure all Nova Scotians that if we give you the first shot, you will have the second shot. But it's consistency of supply, and this week that decision is actually, I guess, holding up much better. Dr. Strang, you were getting criticized, and a lot of people were criticizing province for not doing more one-shot doses early on. This is the reason why we didn't do it. We wanted to reassure all Nova Scotians that if you get your first shot, we will have your second shot ready. And until we see a level of consistency in supply, that's the protocol we're going to continue to follow.
Go ahead, Keith, with your follow-up.
I just need some clarification, but I think we're at that position, Dr. Strang, is my understanding, is because of the epidemiology. If we were, say, in Ontario's position, might that position have been changed? Are we, in other words, are we afforded the luxury of doing it this way because our numbers are so low?
One of the reasons, but we also look, the CCMH has been our statement was you could extend, but only a limited extension up to 42 days, rather from a 21 or 28 days. It's only a week or two. So there'd have to be substantive reasons to change your whole vaccine program. We've also talked at our vaccine expert panel, where we have immunologists there, and they have warned very carefully that the last thing you want to actually have happen is lots of people who may be partially immune from a single dose of vaccine and lots of virus circulating. That is a recipe to potentially breed further variants and mutations in the virus. So what's happening in other provinces is actually there's a lot of question around the science behind that, and so we have to be extremely careful. And that is why CCMH has said stick with the license schedule unless there are compelling reasons to do otherwise, and that is what we're in the position in Nova Scotia where we can stick with the license schedule.
Next, we'll go to Sarah Plowman from CTV. Go ahead, Sarah.
Hi, thanks for taking my question. I want to ask you, how concerned are you that we aren't getting vaccines next week? How confident are you that we will actually get vaccines as we were told?
So we still have a fragile vaccine supply, and it is concerning, but that we'd like to get as much vaccine as quickly as possible. The fact is that is ultimately out of our control. We are focusing on building a vaccine delivery model that is flexible, that we can ramp up or ramp down as necessary as our vaccine supply comes. We continue to stay involved at multiple levels with the federal government and pushing to make sure we get, our per capita allotment of vaccine throughout this whole process, and working whatever we can do to support the federal government in their international discussions and discussions with manufacturers.
Go ahead, Sarah, with your follow-up.
And I understand that a number of tests were being sent to a lab. You were looking to see whether there were other UK or South African variants found in those tests. Have you received the results from those tests, and if so, what did they show?
No, the first batch came back, and we batch them and we send them off every 2 weeks, and so we expect at the most frequent we'd get a batch of results every 2 weeks, but acknowledging that there's a lot of pressure on the national lab, which is the one lab which is doing this sequencing from across the country. So we have to be patient. We will get those results. They don't change anything we're doing in terms of our response to individual cases. So the timing of the information bag is not a concern from my perspective in terms of what we're doing on the ground in public health. It's important information as we look at things over time, but we do have to recognize the challenges at the national lab, and we're patient. We'll continue to submit specimens as necessary and wait for those results to come back.
Next, we'll go to Alicia Drouse from Global. Go ahead, Alicia.
Thank you. I know that you said that you're still expecting Pfizer to make up for any vaccines that we missed within that first 90 days, but I'm just wondering if there's any concern with Europe right now talking about controlling the export of vaccines, how that could affect, even our 90-day plan.
So I'm not involved. I mean, I saw a headline just before coming here that the Prime Minister has reassured that that should not affect our Canadian supply. Those are international conversations led by our federal government. I think what we should be taking from this is that our vaccine supply still remains uncertain and tenuous, and that's something we need to feed that into how cautious we are in our approach to COVID, knowing that we still have not long-term certainty of supply.
Go ahead with your follow-up.
And I'm just wondering if you can clarify a little bit on this first phase. So in some of the stats online, it says that we're expecting about 75,000 people to be immunized by the end of March, but also that there's 86,000 Nova Scotians that are of the age of 75 and over who are likely to be eligible to receive the vaccine during the first phase. So those two numbers don't really make sense to me. So I'm just wondering if you can, clarify that a little bit.
So that's why we say our priority for the vaccine we have in phase 1 is acute care workers who are directly on the front lines dealing with COVID patients, as well as long-term care staff, residents, designated caregivers. We're going to use a small amount of the vaccine to do these prototype clinics. And I use the example of the IWK, 80 seniors living in the Halifax area who are 80 years of age or older. And we'll figure out how to make that model work best. It won't be until we get a much more robust ongoing supply that we're able to take a model like a senior-focused community clinic and roll that out over time across the province, and then be able to move the age gradient down. So everything we're doing, you're hearing about in other than the healthcare workers and long-term care in phase 1 is simply small amounts of vaccine to prototype different models of community delivery.
Next, we'll go to Eloise Rodriguez-Kizibach de Radio-Canada.
Yes, hi, bonjour. So just to follow up on my colleague's question, I understand, Dr. Strang, that you're working with the First Nation communities for the vaccine rollout, but do you have an estimate for when vaccination clinics could start in First Nation communities, just to have an estimate? And maybe if you can tell us as well why the province decided that they're not part of the priority group for the vaccination.
So I'm going to answer your second question first. They are one of the priority groups. We've made them a priority. We're prototyping a clinic. in the first phase when we have limited amounts of vaccine, and we've said certainly when we get into phase 2, they will be one of our vulnerable communities that we make a priority along with age-based immunization. So they are a priority. We only have so much vaccine to go around right now. So, and exactly when we'll be able to do our prototype First Nations community clinics, we're thinking, whether we can do 1 or 2, will depend on what we get on vaccine and the timing of the vaccine in February and March. We only have assurance of supply in 2-week blocks. We know we have none this week, and then the amounts that I indicated next week, the week of February 1st. Beyond that, there is no certainty of anything, so it makes it difficult to plan definitively into beyond 2-week blocks. But we're making all the connections, having the discussions with the First Nations communities to have things planned as much as possible, so when we're able to start the vaccination, we can do so very promptly.
Go ahead with your follow-up, Eloise.
Thank you. And then about testing, you're encouraging post-secondary students to get tested, but it wasn't mandatory for returning students like it was in the fall. So I'm wondering how many students are stepping up. Do you have the proportion of returning students who came back after the winter break who got tested? Do you have numbers or proportions for that?
So the last we had about 63% of the students who were quarantining got tested. The reason we're saying testing now is not because of the quarantine. It's simply because we've had a case of a student who was tested positive last weekend. A Dalhousie student. So like we've done all along, we're going to expand when we have a signal of COVID. We expand our testing in the local area, the local community around that case, and we're asking anybody can come and get tested. We encourage any Nova Scotians to consider getting their asymptomatic testing, but around this case, we're especially encouraging students on the St. Mary's campus, on the Dalhousie campus, NASCAD. Students who go to peninsular post-secondary institutions, because that's the group that we're most interested. If there's any further spread of the virus, that's where we're most likely to see it.
Next, we'll go to John McPhee from the Chronicle Herald. Go ahead, John.
Thank you. Dr. Strang, I realize the details are still being worked out for the IWK clinic next month for people over 80, but do you have a sense of how many people, like the scale of that clinic, how many people could be vaccinated each day, how long that will take to get the proportion of the population that you're targeting?
So as I just said, John, we have no guarantee of how much vaccine we're actually going to have available for that clinic. So we're working out the details, but until we actually get guarantees of amount of vaccine, we can't say exactly how many people we'll be able to put through that clinic.
Go ahead, John, with your follow-up.
Thank you. Just to follow up on the IWK clinic, why is only one site being planned for this phase of the vaccination program, or am I misunderstanding that? Is that going to be the beginning of the program for people over 80, or is that strictly going to be the one site?
No, it's a prototype clinic. So as I've said before, during the first phase, we're modeling or prototyping at different types of community clinics with limited amounts of vaccine to learn from them. So when we get into phase 2 and much greater amounts of vaccine, we could replicate that to age-based clinics around the province. But in phase 1, we only have a small amount of vaccine, so we're doing the prototype so we can learn.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Thank you. Dr. Strang, given our sustained low case levels with just 11 active cases today, I'm wondering if you can explain what type of altered restrictions might Nova Scotians expect in the coming weeks if levels stay as they do right now?
So I'm not going to speculate. We're going to, as we said last week when we announced the slight modification in restrictions, what those changes came into effect yesterday. They're in effect for 2 weeks. Next week we'll look at the epidemiology and say what is it telling us and what we may consider in terms of opening up. But I'm not going to speculate of where we may end up. It's premature. Our epidemiology looks good now, but as we've learned, looking at other provinces, that can change very quickly.
Go ahead, Lindsay, with your follow-up.
Thank To follow on that, I'm wondering if you can explain the rationale between keeping restaurants closed at 11 p.m. I understand these late-night bar situations were at one point a cause of concern, but with 11 active cases, is that concern still there? And the same question for parents not yet being able to watch their children at sports practices and games.
So in terms of restaurants, it's a slow, cautious approach. It wasn't that long ago when we had restaurants in Halifax were closed. Now they're open to 11 o'clock. We'll look at where and when we can expand their hours, but we have to do it safely. I don't know how to say it any differently. A slow, cautious approach. In regards to sports, it wasn't that long ago before kids in Halifax weren't playing hockey at all, and now they can play hockey. So I asked the parents to be patient. Before I came here, I got an email from Soccer Nova Scotia, and they were on a national call. And they said the emotion that was expressed on that call, because in virtually every other province, they don't know what they're going to do. They can't even play soccer. So our focus is first and foremost to get kids playing. When it's safe, we'll get parents back into the stands. But we need to be slow and careful about this. And I have to say what I said last week. Focus on what you can do in Nova Scotia compared to elsewhere, not what you can't yet do, please.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hi, good afternoon. I have a question for the Premier. Today, the Canadian Centre for Policy Alternatives issued a report reviewing government supports for COVID programs and such. It's generally a positive report, especially so far as the federal government goes. And it's not bad for Nova Scotia, but one thing that they do cite for Nova Scotia is the Safe Restart program in terms of the federal transfer for municipal operating and transit budgets. It says that the province is passing the federal funds to cities as required, but is not matching the federal dollars as is required in the agreement. I wonder if you could speak to that.
We would have met all of our obligations in terms of any of the programs that would have gone to the municipality or any other program that we would have been there. So if it is a requirement, I think the total amount that came in was $66 million. I think for Nova Scotia, which was actually what they had asked for, and I forget the exact amount that we had added into transit. So I don't know that, Tim. I can find the answer to that out for you and get back to you.
Go ahead with your follow-up, Tim.
Dr. Strang, you're involved in these conversations, I assume more than the rest of us. Do you have any updates or information about the status of the Johnson & Johnson vaccine or the Oxford vaccine?
I'm actually not. That's data that comes from the companies presented to Health Canada. We don't get updates of that at my FPT tables until it's actually gone through the regulatory licensing process through Health Canada. Until that time, it is kept confidential.
Next, we'll go to Victoria Walton with the Coast. Go ahead, Victoria.
Thank you. So I'm wondering about an exposure notice that came in, I believe it was Monday, just for a flight exposure. And that warning came in after the 14-day quarantine was up for people on that flight. I'm wondering if this is another case of someone coming down with symptoms after their 14 days, like we had with the Acadia student last week.
So I don't know the details of that case and the notification around it. That would have been from NSHA, Public Health. It's often we get people, it's once we interview them, knowing that many people can be asymptomatic. So when we interview somebody and we say, where were you in the 2 weeks in that time when you may have been infectious to others? Sorry, not the 2 weeks, the 48 hours. And so they may have come in being completely healthy and either then become sick or gone for asymptomatic testing. And it's only then when they test positive that we work backwards. So the fact that there's a notification on a flight doesn't mean that somebody has done something wrong and traveled when they shouldn't have.
Go ahead, Victoria, with your follow-up.
Thanks. And I know you said we would run out this week of vaccines before we receive new ones because we won't be getting any next week from Pfizer. And I believe you said none from Moderna next week either. So I'm just wondering if you have an estimated day for when we might run out of doses, and how many days vaccine clinics might be shut down for before they reopen when we get the new doses the following week?
I don't have a specific day. When I was briefed this morning, I was told that we will use all the vaccine we have before we get more. It's unfortunate that we're in that position, but I think it also means that it's a demonstration to Nova Scotians that when we get vaccine, we very quickly get it into people's arms, or we hold it back for the second dose when that person becomes eligible. We don't have vaccines sitting around waiting to be used.
Next, we'll go to Carolyn Ray from CBC.
Thanks. I was just wondering, this week we heard accusations against the former CEO of the company that owns Casino Nova Scotia of flying to Yukon and jumping the queue to get a vaccine. I wondered if you've had any situations here in Nova Scotia of people trying to beat the system and jump the line.
None that have been brought to my attention. I mean, our tight, the eligibility groups we're using now are very tight. So it has to be a healthcare worker in the system that we would known about occupational health. We use their list, and then when we're in long-term care facilities, we know who the residents, the staff are. People have to also be selected and approved as a designated caregiver. So there's very little room for slippage in our program at this point in time.
Go ahead, Carolyn, with your follow-up.
Thanks. And do you have protocols in place when it does open up and the vaccines are going to wider areas to ensure that this doesn't happen?
So we will be the basic we're using. You'll be eligible if you're a Nova Scotia resident, and for most people, that's having an MSI card. There are some temporary foreign students and others who don't, but basically having an MSI card is how we're going to communicate to people through that information.
That's all the time we have for questions today. Go ahead, Premier.
Thank you, Tina. It's always a good day when we can talk about a low number of cases in Nova Scotia. I want all of you to be proud of how well you've been doing in coping with COVID-19. Without your cooperation and willingness to follow the protocols, we wouldn't be where we are today. Some of you may be wondering, as a question was just asked, with 11 active cases in our province, why don't we lift further restrictions? I can tell you, it has definitely been part of our discussion, but with the variant already making its way into this province, thankfully we believe we've controlled it, but it is not something that we can ignore. It arrived without any warning, and COVID is bad enough. But with the variant, it's far more aggressive, far more difficult to predict, and with the uncertainty around supply of any vaccine, we have to be extra cautious. And so we will continue to keep things the way they are in this province. We're open for business, as Dr. Strang had mentioned, with restrictions, but we're not wide open for gatherings. I hope all of you can understand. I know you're making sacrifices, and I know it's hard, but we are putting your safety first. Thank you for your patience.